If you've been dealing with recurring back pain, there's a good chance you've spent a lot of time focusing on your back. Maybe you've stretched it, foam rolled it, strengthened it, or had treatment directed specifically at the painful area. But what if the problem isn't entirely coming from your back? What if your back is simply the area that's absorbing stress from somewhere else? One of the common patterns I see is when the hips stop contributing efficiently and the lower back becomes the backup plan. Today, I want to explain why that happens and why improving hip function can sometimes be one of the most important pieces of solving recurring back pain. I'm Dr. Lance Baumgard with Mobility Co Wellness. I provide mobile chiropractic and dry needling throughout Highlands Ranch, Sterling Ranch, Littleton, Castle Rock, and the surrounding South Denver communities. Let's talk about the relationship between the hips and the spine and why where you feel pain isn't always where the problem starts. One of the biggest mistakes people make is thinking of the body as a collection of separate parts. In reality, movement is a team effort. Your feet, knees, hips, pelvis, spine, rib cage, and shoulders are constantly working together to distribute force and manage load. Ideally, no single area has to do all the work. Instead, movement is shared throughout the system. When one region, however, stops contributing effectively, another region often picks up the slack, and that's compensation. Compensation isn't inherently bad. It's actually one of the reasons we're able to keep functioning. The problem occurs when compensation becomes the long-term strategy. The hips are designed to be incredibly mobile joints. They can flex, extend, rotate internally, rotate externally, and move in multiple planes of motion. That mobility allows the hips to absorb and distribute force during walking, running, lifting, climbing stairs, and everyday activities. But many people spend large portions of the day sitting. And over time, they lose some of their available hip motion, particularly in hip extension and hip rotation. When the hips stop moving efficiently, the body still has to accomplish the task. So another area starts helping, and very often that area is the lower back. Imagine trying to reach behind you. Ideally, the hips rotate, the pelvis moves, the thoracic spine contributes, and the movement gets distributed across multiple regions. But if the hips don't move enough, the lumbar spine often starts moving more than it should. The back isn't necessarily weak, and the back isn't necessarily damaged. It's simply being asked to do more work. And over time, repeated loading can create irritation, stiffness, and discomfort. This is one reason many people feel temporary relief when the treatment is directed specifically only at the back. The back is where the symptoms are, but the reason those symptoms keep returning may involve how the hips are functioning, because the hips don't operate independently from the back. They're connected through muscles, bones, and connective tissues such as ligaments, tendons, and fascia that help distribute load. One important structure in this region is the thoracolumbar fascia. This is a connective tissue system that links the lower back, glutes, abdominal wall, and surrounding musculature. And when the hips contribute effectively, the force is shared across the system. When they don't, stress can be concentrated in fewer tissues. And that's often when symptoms begin to show up. It's important to understand that this isn't just a mobility issue. A lot of people immediately think, oh, I just need to stretch my hips. And sometimes that's helpful, but movement quality is about more than flexibility. The body also needs strength, control, coordination, endurance, timing. The question isn't simply, can the hip move? The question is, can the hip contribute effectively during real life activities? And that's a very different conversation. When someone tells me they have recurring pain, I'm looking at much more than the painful area. I'm assessing how the hips move, how the pelvis moves, how the rib cage moves, how the person walks, how they squat, how they transfer load throughout the body. And treatment may include chiropractic adjustments, dry needling, soft tissue work, and movement-based strategies. But the goal isn't simply reducing symptoms. The goal is improving how the system functions together so that the back doesn't have to keep doing more than its share of the work. If you've been treating your back, but the pain keeps returning, it may be worth asking a different question. Instead of, what's wrong with my back? Consider, is my back compensating for something else? In many cases, improving hip function, movement quality, and load distribution can have a significant impact on recurring back pain. If you're in Highlands Ranch, Sterling Ranch, Littleton, Castle Rock, or the surrounding South Denver area, and you're looking for a movement-focused approach to pain, performance, and recovery, you can check out availability through the link below. Thanks for watching, and I'll see you in the next video.